Assalamu alaikum everyone. I hope everyone is staying home and safe in this COVID situation. First, let me introduce myself. This is Kazi Amit Hasan, student of Department of Computer Science and Engineering, RUET, presenting you our research paper titled Prediction of Clinical Risk Factors of Diabetics Using Multiple Machine Learning Techniques Resolving Class Imbalance. Well, the authors are myself, Kazi Amit Hasan, Department of Computer Science and Engineering, RUET, and Muhammad Al Mehedi Hasan, Professor of Department of Computer Science and Engineering, RUET. Moving on. Well, these are the outlines of my whole presentations, and I am going to discuss about these in throughout the whole presentation. Moving on. Well, if we break our title, we will get four keywords that are clinical risk factors, diabetes, prediction, and class imbalance. Well, clinical risk factors means the main factors that are responsible for the diabetics. Well, moving on. Now, what is diabetics? Well, diabetes is recognized as one of the most frequent and rapid growing diseases worldwide. It increases the blood sugar level significantly. Well, diabetics enhances the chances of other long-term complications like heart attack, kidney failure, cardiovascular disease, etc. Moving on. Now, the motivation part. Well, it means what drives us to work on this field. Well, diabetics is the most frequent and rapid growing disease worldwide. Patients also suffer from different severe damages to their nerves, vital organs, and blood vessels. People with ages in the range from 20 to 80 years are at high risk of being impacted by diabetes. On the right side, you can see the age group versus the diabetes prevalence graph, which proves that all ages of people can be affected by this. Moving on. About 465 million grown-ups are affected by this disease, which increases to 700 million by 2045. Well, it has high mortality rate because of the other severe complications, and the delayed diagnosis increases the death rates. Now, early diagnosis can reduce these impacts. It increases the importance of early diagnosis. Moving on, there are some existing problems like there is still no effective solutions of this. The whole process is time consuming and it requires very high cost and experienced manpower. The purpose of our study is to develop an intelligent system that can classify patients, to contribute in medical sector, to reduce the cost of overall clinical analysis, diagnose the patients in early stages. We want to reduce the mortality rate and we want to employ our proposed model which will produce better performance than the existing ones. Moving on, these are the previous works that have been done in this field. Now, this is the diagram of our overall workflow that we are going to discuss in the next slides. Moving on, the dataset description. Well, the dataset used in this research was obtained from the National Health and Nutrition Examination Survey, NHANES. The assembled version of NHANES data from 1999 to 2000 to 2015 to 2016 was utilized for this study. The dataset has responses of 37,079 people with 51 types of different attributes. There is a total of 37,079 respondents in this dataset, containing 4,852 diabetes patients and 32,227 normal patients. Moving on. Well, in the data pre-processing part, we have done three things. That is outlier handling, and we have assigned some class weights, and we have done data standardization. In the outlier handling, we have used the IQR method, and in the class weight, the problem was handled by assigning class weights. And to assign the class weight, we have used the scikit-learn tool. And we have also used the scikit-learn tool to standardize the data. Moving on. Well, these are the images of two parts, that is before the handling the outlier and after the handling the outlier. On the left side image is the image of before handling the outlier. The right side image is the image of after handling the outliers. Moving on, the risk factor analysis. Well, the potential risk factors were identified and investigated by using logistic regression and ANOVA methods. As a result, age, blood-related diabetes, cholesterol, and BMI attributes are found as the most significant risk factors associated with diabetes. On the right side, you can see the features and their F scores, which represents the significance of the risks. Moving on, the stat models tools were used to measure and identify the relative risk factors in the dataset. According to the table, the age, diagnostic, cholesterol, blood-related diabetics, and are the most significant risk factors along with the risk factors associated with diabetes. On the right side, you can see the figure of risk factors with their p-value. Well, in this research, we have considered the p-value less than 0.05 for this research. Moving on. Now, the best methodologies and results. The best results were achieved with CV equal to 10 and the random forest and ensemble approach. The hard-coding method was used for the ensembling in this research. On the right side, you can see the accuracy and the AOC scores of our research. Moving on, the future scopes. Well, we want to provide a web server for our method. We want to apply our process on the more data sets and diseases. And in the conclusion, we want to say that we are proposing a system that can distinguish the patients very effectively. It can assess specialists to determine the appropriate treatment, and it can reduce the other clinical complications along with diabetes. And well, these are the references that I have used in my presentation slides. And thank you everyone. Any kind of questions are welcome.